Hello everyone, welcome back. The topic that we are going to discuss about in today's video, it is the processing of X-ray film. Now this processing of X-ray film, it is a part of our curriculum. That means in final year what we are doing is we are taking an IOPA. So through that IOPA, what you need to do is you need to go through the steps of processing to get the final image on that IOPA film. Now this processing part, it is omitted in the RVGs. Why? Because RVG in itself, it is a digitalized form of the X-ray. So for example now, if over here, this is your X-ray film and you are exposing it through the radiation. So when the radiations are exposed on this film, you will get the image that is known as a latent image. Now latent image, it is the invisible form of the image. That means you cannot see the image on the film. So to see that image, what you do is you go through the steps of processing to see that final or the visible image. Now there are different steps in the processing of the X-ray film. So in this particular video, we are going to see the theoretical part of the processing of the X-ray film. Even I am going to show you how practically you do the processing of the X-ray film. So what do you mean by processing of X-ray film? X-ray film processing, it is nothing but it is a series of steps. Now you can see over here, so this is a flow chart. So basically processing is nothing but a series of steps that will produce the visible permanent image on the dental radiograph. Now what are the purpose? So what are the purpose of doing the processing of the X-ray film? So the first purpose is visible image formation. Now what we have seen is latent image is formed when you are exposing the patient to the radiation, and after that what you do is you go through this processing. Why? To get a final image. So the first is you can see the image because of this processing only on this IOPA film. So the next purpose of processing is preservation of image. When you take a X-ray, you are processing the film. If the patient is coming later on, afterwards or after some months or years, that time also you will have this image which is preserved with you. So processing will help in the preservation of the image by the formation of the visible image. Now what are the types of processing? So there are different types of processing. So the first type is known as the manual processing, the one which we are doing in colleges. So manual processing, it is also known as wet processing, and it is carried out in the dark room. Now in colleges also you have this particular rooms which are made as dark rooms where you are going to process the X-ray film. Why? Because you don't require light when you are processing the X-ray film. If there is exposure of light when you are processing, so you won't get any image on the X-ray film, and that will be one error which you can see in the processing part. Now in this, there are two types of manual processing. One is known as visual, and the next one, it is known as time temperature method. Visual method, it is the method in which the film, it is kept in the developing solution and the unexposed area, it is looked for complete darkness. So visual is basically when you are visualizing the radiograph. Now the next one is known as the time temperature. Now in this method, you have a specific temperature of the solution for a specific time, and by that you are going to get the image on the X-ray film. So now these are the most important factor in the processing of the film. Now time and temperature is very important part of the processing. Why? Because if you are keeping the X-ray film for a very longer time, that will also hamper the image quality, and if you are keeping it for very less time, that will also hamper the image quality. And if the temperature also is too much or it is too less, that will deteriorate the image. So the optimum temperature which is given for the development is 20 to 22 degrees Celsius. Now if the temperature, it is less than 16 degrees Celsius, so it will lack the contrast and the density, due to which the image quality, it is deteriorated. And if, for example, if the temperature of the solution, it is more than 24 degrees Celsius, so in that case the image, it will fog. Again, you cannot see the proper image on the X-ray film. So for that you need proper time and temperature. Now there are various temperatures which are given. So for example, if the temperature is 80 degree Fahrenheit, so in that case the time in the developer, so you should keep the film in the developer solution for 2.5 minutes. And then you need to rinse it for 30 seconds, and then you need to keep the X-ray film for 5 to 6 minutes in fixer solution. So I'm going to share this flowchart, like what different temperatures can be and for how much time you need to keep the image in the developer solution and in the fixer solution. Now the next type of processing of X-ray film, it is known as automatic processing. So manual is basically what you're doing, you yourself are doing everything. So there are different steps in this processing. First one is the developing and the next one is fixing. So you yourself are going to do each and everything. But in automatic processing, this term, it is used when the processing is carried out with the help of a machine that is known as the automatic machine. So what you do is you just take the X-ray and you place the film in this machine and it automatically will produce the image. So you yourself don't need to do each and every step. So that is nothing but automatic processing. Now in this automatic processing, there's also a subtype which is known as self-developing image. So basically this self-developing film is the sachet itself contains the developer and the fixer, and you're going to develop it on that particular like film packet itself. So you don't need this processing unit for the processing of the self-developing film. Now the next type of processing is known as monobath method. Now as the name says, monobath is, so the developer and fixer, so they are mixed in one solution itself. That means you're just going to dip your X-ray film into the solution which is containing both of it simultaneously. So these are the types of the processing of X-ray film. The one which we are doing is manual processing, and even I'm going to show you practically manual processing only. Now what are the stages of processing? So now the stages of processing are, first one is the manufacturer. That means you get this X-ray film from the manufacturer itself. Now this X-ray film, the contains, we have already seen. So the X-ray film, layers of X-ray film, it contains a emulsion layer, that is the main layer in the X-ray film. So this is the X-ray film packet. Again, the content of the X-ray film packet we have already seen. So over here, this is your X-ray film, the film where you get the X-ray. So this X-ray film, it contains a layer of emulsion, and that layer of emulsion, it has the crystals of silver bromide, which is going to help in the image formation. Now the crystals of silver bromide, they have some sensitivity spike which are made on which you will get the image, and they are suspended in the gelatin layer. So now we are going to see the stages of the processing one by one. Here the first step is before exposure, the X-ray film that you get directly from the manufacturer. So it has this silver bromide crystals. That's the main thing that you need to remember. And it also has some sensitivity site which is sensitized by the radiation. So the next step is after exposure. Now what is the difference that you can see in this before exposure and after exposure? There's some like yellow and black color dots which you can see after exposure. Now what are they? So now as I said, we have the sensitivity site which is present before exposure. Now when the patient is irradiated, so after that, those sensitivity site, they are going to get converted into the latent image. Now what latent image is? We have already seen that in the latent image formation. So latent image is nothing but it is the invisible image which is formed on the X-ray film, and you need to go for processing to see it. So over here, this yellow and black dots are nothing but the latent image sites. This latent image is nothing but it is the neutral atom of the metallic silver. Now over here we had the crystals of silver bromide, but latent image site, it contains neutral atoms of the metallic silver, and that will give you the latent image. The next is you're going to start with your processing. Now processing's first step is known as developing. So you have a unit of 3 containers in which, so I'll show you how exactly it looks like. So over here, this is the like processing unit. It has this 3 containers. So the first is the developer container in which the developing solution is there. The next one is the container which contains normal water, and the third is fixing solution. So it contains fixing solution. So first step is developing. So now what does developing exactly do? So it converts the latent image into the grains of the metallic silver. So as I said, latent image is nothing but they are the silver ions, neutral atoms of silver ions. So what does this developer do? So developer, it will reduce this crystals of silver ions into metallic silver grains, and that will lead in the formation of the diagnostic image. So this diagnostic image formation, so this should be like restricted to the crystals which are containing only the latent image. So I'll show you over here. So now you can see which crystals contain this latent image. Over here, this like particular crystal is containing the latent image. So this crystal is containing this latent image, and when you go through the developing, only they are getting reduced into the metallic silver. So you can see over here, so this particular crystal is not having the latent image, so it is not getting reduced also. So basically it should be restricted such that only the latent image sites, it should be reduced to the metallic silver. Now why? Because if all the crystals they are getting converted, or if all the crystals they are getting reduced, so in that case it will lead to the chemical fog, and that will reduce the quality of the X-ray film. Now over here, this is the graph which is given for the development time and the film density. Initially the density, it is going to increase, and at one point it will be completely developed. Now over here, this is the exposed like crystal. So in this case, so over here this curve is particularly for the exposed crystal. But now if the unexposed crystals are also getting developed or also getting reduced, so in that case that will lead to the chemical fogging of the X-ray film, and the density, it is going to increase very slowly due to the chemical fog. So this is the like graph for the development time and the density, like how the density is affected if you're keeping the X-ray film in the developer solution for a very long time. So in that case, how the density is going to get affected. Now what does this developing solution it contains? So this is the bottle, how it looks like for the developer solution. So this developing solution, it contains a developer that is going to develop your X-ray film, the activator, a preservative to preserve the solution. The other component for the developer solution is the restrainer. Now which are these different constituents? So the first constituent, it is known as phenanedione or elon or metol. So what are they? They are nothing but the reducing agent. So they are going to generate the gray tones in the image. Now over here in the developing, so first component is your, you can use any of this. So this container, it contains any of the reducing agent which is going to basically reduce the crystals. The next one is the hydroquinone. So again it is a reducing agent, and it is going to generate the black tones. So you have to remember this very well, because this is very commonly asked in the MCQs, like which particular reducing agent it is going to generate black tones, or which agent is going to produce the gray tones. The next component is the sodium sulfate. Sodium sulfate is nothing but a preservative, and it reduces the oxidation. If by chance, if a preservative is not present, so it will oxidize, and that will deteriorate the quality. The next one is the potassium or sodium carbonate. Now what is this potassium or sodium carbonate? So this is an activator. So what it is going to do is, it is going to soften the emulsion layer. Now the next component is a restrainer. So benzothiols or potassium bromide, it is a restrainer which will prevent the fogging of the film. Next is the glutaraldehyde, which is acting as a hardener. The next is the fungicide, it is the antibacterial. Buffer, which is going to act as a buffer. So buffer is going to maintain the pH above 7. Water is a solvent, so it dissolves all the chemicals. So this is all about the developer solution, what it contains, what it exactly does. The next thing that you're going to do is you're going to rinse it in the water, because what will happen is, so the extra developer, it will be present on the X-ray film, and due to which the fixing part, it won't be done well. So to remove the extra developing solution, you need to rinse it in water well, and then you need to go for the fixing. Now over here, so this is the comparison for it. Now can you see the difference? So this is somewhat brownish, the quality is not so good. So if you are not removing extra developer, or if for example if you are not removing extra fixer also after fixing, So that will lead to brownish discoloration or brownish stains which are present on the X-ray film. So if the processing or if the technique of radiograph is not going well, so in that case what you need to do is exposure. First thing, exposure is going to increase, the radiation dose is going to increase. The next thing is the processing part will also happen twice, and this work in itself is time consuming, so you don't want to do everything again. So in that case, please follow proper procedures, please follow proper steps when you're doing the processing also. So first one is developing, we have already seen, then you're rinsing it, and then the next step is you're going to fix it. So now you're going to immerse the X-ray film into the fixer solution. Now what this fixing does, so it dissolves the remaining silver bromide ions and it is going to harden the gelatin. Now what we have seen is, so these crystals, they are suspended in the gelatin layer. So your fixing solution is going to harden that gelatin layer and it is going to dissolve the silver bromide crystals which are present. This is your developing stage in which we have seen the latent image sites, they are developed. Now the next one is the fixing. Now what difference can you see over here? So some crystals, they are lost in the fixing solution. The crystals which are not exposed are removed in the fixing solution during the fixing step. Why? Because as I already said, if you are not going to remove this unnecessary unexposed crystals, it is going to lead to the fogging of the X-ray film and the quality is deteriorated. So fixing, basically it is going to dissolve unnecessary unexposed crystal and you are just going to have the exposed crystal by the end of the processing. So fixing solution, it removes the underdeveloped silver halide crystals, and if you are not removing the silver halide crystals, so what will happen is it will lead to unnecessary darkness of the X-ray film and that will be non-diagnostic. Fixing, it also hardens and it shrinks the emulsion. Now what are the constituents of a fixer solution? So first is we need a fixing agent which is going to exactly fix the X-ray film. So it is going to remove the unsensitized ions of silver halide crystals. So the constituent which is going to do that, it is known as ammonium thiosulfate. Preservative is again that we have seen in the developing solution, that was your sodium sulfate, or in this it can be ammonium sulfate too. So what it is going to do is it is going to prevent the deterioration of the fixing agent. The next is the hardener. Now as I said, it is going to harden the gelatin layer. So the hardener which is present in the fixer solution, it is known as aluminium chloride, which is going to shrink and harden the gelatin layer. There's a acidifier which is present in the fixer solution, that is known as acetic acid. So what it is going to do is it is going to maintain the pH and it is going to stop the development by neutralization. Next again, water, which is going to act as a solvent which is going to dissolve all the chemicals. So these are the different constituents of a fixer solution. And the last thing that you're going to do after fixing is you're going to rinse or you're going to wash the X-ray film under tap water so as to remove the product of fixing. So after fixing the process film, it is washed in water to remove all the thiosulfate ions which are present of the fixing solution basically. So if you are not removing, so that will lead to the staining of the X-ray film. So for that you need to remove the, now in this also there's a big line of stain which is present. So we are going to discuss each and every error, each and every faulty radiograph through this IOPS only. So I have a big set of IOPS which are present with all the errors, so that you can see how exactly it looks like. So now over here also you can see or you can appreciate the difference if you are not going through the processing well. And the last part for the processing is drying. So you're going to remove the excess water which is present and you're going to dry the film. So these are the steps of the processing of the X-ray film. Now lastly, I'm just going to mention about the oral radiology dentistry made easy book. So in that also I have explained or I have mentioned each and everything in this manner only. So this is exactly how the book it looks like for the oral radiology, textbook of oral radiology by Dentistry Made Easy. And this topic I'm going to show you. So the latent image, we have already seen about it, and over here this is the processing of the X-ray. This is the chart that I was talking about for the time temperature method of the manual processing. So you have this different temperatures and at this different temperatures, what is the time which is allocated for the developer and the fixer solution that you need to keep the X-ray film for. Over here again, these are the stages, the diagram for it, then the developing solution. Over here, this is the table for the constituent, the action and the function, which is explained well, which is explained in depth, like what exactly this particular constituent is doing. Next is the fixing solution. So over here, this is the incomplete fixation, due to which you can see the stains which are there. So the next part that we are going to discuss about for this processing will be the procedures. So this is how it looks like. So this steps I'm going to explain, or I'm going to show you practically how we are doing it. So this is the unit that I was talking about for the automatic processing. This is the machine. You just insert your film over here, and it itself is going to go into developer, itself is going to go into the fixer, and you're just going to get the complete final image through this film exit. So this is the automatic processing unit, the self-developing film. So this is how the film sachet looks like for the self-developing film. So this is the book that is made by us, that is Dentistry Made Easy, like oral radiology book. So the details how you can buy it will be shared in the description box below. So this is all about the processing of the X-ray film. I hope you found this video helpful, and if you did, then please like, comment, share and do subscribe to my channel. Thank you so much.